So now coming back to other health benefits. One good one, for instance, I put out there is lowering your blood glucose and your insulin levels. When you do that, it helps reduce the risk of developing type 2 diabetes. Now, that is for people that may be on the cusp of developing that, or for people that are already diabetic, you can actually use intermittent fasting to reverse your diabetes. Now, we do not use
Yeah.
the word cure for diabetes, but we say reverse and put your diabetes into remission. That's one of techniques. The nuance of that is something probably if anybody wants to know, they'd have to contact me because I would have to actually take them through a specialized process for that. But you can just simply just start what you call by doing intermittent fasting to help with that. So one of that is it helps work on diabetes. Now, apart from diabetes, there is the whole metabolic, what we call the whole metabolic syndrome and the whole metabolic issue. What is that? So people talk about metabolic syndrome. It's essentially the combination of high sugar levels, high insulin levels, and changes in the liver that result in things like fatty liver. And when the changes come, you see things like obesity in people where they carry a lot of truncal fat in the body and their blood pressure goes up and they become diabetic. So that is the whole metabolic syndrome picture. They said
Yeah.
people put it in three things. You are diabetic, you have hypertension, and you have fatty liver disease. That's what they really term metabolic syndrome. You can break it down into other things there, but those are the three main confounding factors there. And intermittent fasting is a single potent tool that can work through all these three things and help reverse these particular changes in your body. So the benefits include things like, as we said, helping your helping your body reverse metabolic changes. Interestingly, another good factor now this has not been clinically proven in humans, but they've done tests in um, mice. They've done studies in mice to help prove this particular thing, where we do something called autophagy.
Yeah.
When we say autophagy, we're talking about programmed cell death and renewal. One of the things our bodies need to do is renew your cells over a period of time. So if we think of the concept of cancer, for instance, what cancer really is in it, and this is me being very oversimplistic, is it's too much growth. Something is just growing too much. It has not found a way, the body has forgotten or it has mutated to tell it to stop growing. So what autophagy does is there are some cells in the body that are old and are not functioning well, and it just goes to tell them to switch off and what do you call it, be absorbed back in the body. They go into what you call apoptosis and die, and the body absorbs them. So it's like if how best way to use it is if you think of you go to the federal government building and there's someone just comes there and decides that all the ghost workers need to go. You understand? All the people that ghost workers
Yep.
that work need to be taken away. Clearly, once you do that, you are going to make the department more productive because all the people that are pruning and stealing money, that goes away. That's just a quick
Yes.
analogy. Autophagy is programmed cell death that you help clean out bad cells, which gives room for the good cells in the body to proliferate and function better. So that's essentially what it does. Now, whether the nuance of getting into autophagy is completely separate, we can get into that later. Before you can really achieve or benefit from autophagy from fasting, you have to have done at least from the studies, at least a 36-hour fast. And that's when your body really starts kicking into things like autophagy. And that's one of the benefits. There are also one of the other proven things that it's a probability which has not been proven 100%, but it's the fact that intermittent fasting or fasting in itself is beneficial in people that have cancer, or it's also beneficial in reducing the hallmarks of cancer and inflammation. Because when you get into the fasting period, you turn off some particular signaling molecules, things like we call it mTOR, mechanistic target of rapamycin, and growth factors and growth hormones like insulin. Because we are in a constantly fed state, everybody's eating, insulin in our body is constantly spiking up and down. Now, most people, and even here in the United Kingdom, what most people measure when you go to your doctor is your sugar levels. People don't readily measure insulin, which ideally we should start doing. Because once your insulin is spiking, insulin is a growth factor. So it signals the body to start growing, quote unquote, making things grow. If you think about it, if you are pushing fat into cells, it's going to grow bigger.
Yeah.
That's one of the mechanisms anyway. So if when you do intermittent fasting, your insulin levels will come down. And once your insulin level comes down, the signaling for things like the mTOR also comes down, and your body starts to calm down. The inflammatory pathway starts to slow down and calm down. When that happens, the probability of you developing mutations and cancerous cells drops slightly. Now, most of these are all studies. These particular ones are studies that have been done in lab mice and have
Yes.
obviously just extrapolated it to human beings. The thing about it is that in medicine, people we will say we have to base everything on evidence-based medicine. But the truth of the matter is that evidence-based medicine is not what you sorry. Evidence-based medicine is consensus for people. It's not something that happens straight away. It takes its time. And
And observation.
yes, and it can be quite a long time before it comes to fruition. So some of us actually have to do anecdotal stuff, try it out with patients and let it work. And you can tell people that it's working for a
Yes.
period of time while
Yes.
science is still working its way out. So essentially,
Yes.
those are the main things. So helping autophagy, reversing metabolic problems, reducing inflammation, and possibility of reducing cancer or preventing cancer generating cells. So I think those are the main ones that I probably mentioned off the top of my head now for
Yes.
intermittent fasting or fasting.
Yes. And those are health benefits. So now in
Yes.
intermittent fasting, one thing I want to mention here. So unlike when you are fasting spiritually now, that is with
Yeah.
your religion, when intermittent fasting now, you can take fluids in the window. There are fluids that you can take. You can take fluids. You can take minerals as well, like your salts,
Yeah.
magnesium, and some things to ensure that your body is hydrated and properly nourished in
Yeah.
those in that time window when you are actually fasting. So have
Yeah.
it in mind. So it's not exactly going to be the same thing as quote unquote what we call a dry fast, right? Where
Yeah.
you say, "Oh, I'm fasting dry." You can
Yeah.
actually take water. You can actually take some minerals to
Yeah.
help you replenish your system while you're actually observing that period before you
Yeah.
eat. So it's something that is encouraged, and people who are in the major category now who are trying to actually lose weight should
Mm.
actually use this as a tool with exercise and with
Mm-hmm.
the diet. Because, like Tosin said in the last video, that he wants to assume that if you are fasting, or rather, if you are undergoing intermittent fasting, that you're also exercising. You know, he said that clearly.
Yeah.
And I want to assume that if you're exercising and observing intermittent fasting, which are two hard or difficult things to do, that you should
Yeah.
also be ensuring that you're eating correctly.
Yeah.
So if you apply these three things,
Yeah.
if you apply these three things, eating correctly within that time frame, so it's not like as though you're going to fast, then you just go in and you're eating burgers, fries, all the things that are not necessarily good for your body. You want to get your nutrition correctly according to your goal,
Yes.
according
Yeah.
to your goal. So everyone has a different goal. If you are trying to lose fat and retain muscle, if you're just trying to drop weight, all in all, whatever your goal is, your diet is important in that window. So you want to ensure that your diet is right, you're fasting, and you will definitely see the drop in body fat over time. And it's a pretty successful thing.
Yeah, most definitely, most definitely.